In this lecture, we are going to talk about the second example of intestinal nematode, which is Trichinella spiralis. It belongs to the family of Trichinellidae. Male nematodes that belong to this family has no copulatory spicules, and females are viviparous worms that lay larvae, of which only one worm is Trichinella spiralis. It is spread mainly in the United States, Europe, and some parts of Africa where pork is eaten. Definitive host: human beings, pigs, and mice, where each of them serves as a definitive host and an intermediate host. Parasitism site: adult worms in the small intestine and larvae in the muscle. General morphology: these are small worms. The anterior part of the worms is thin and the posterior part is thick. The mouth is located at the front of the body and has no lips around it. It leads to a cellular esophagus that extends to about half or a third of the body, followed by intestines that open at the end of the body in the anus. The length of the male, up to 1.5 millimeter, is shorter and thinner than the female, and the copulatory spicules are absent, and has a single reproductive system. The female is taller than the male. It is about 4 millimeter in length and 0.06 millimeter in diameter. It has a single reproductive system that opens with female vulva opening at the end of the first fifth part of the body. The female lays embryos and is therefore a viviparous worm. Life cycle: when a human eats infected and poorly cooked pork, larvae are released in the stomach, reach the small intestine, and grow in 2 days, where they are molted twice before becoming adult worms. Adult worms live in the small intestine of humans, mice, and pigs, where they live under the mucous membrane of the intestine. After fertilization, the male dies. The female then inserts her frontal part in the intestinal wall, that's to say in the mucus layer, and begins to lay the larvae. The larva penetrates the mucus layer into blood vessels, the heart, lungs, and then the heart are again distributed throughout the body within 8 to 14 days. The larvae then reach the voluntary muscles, are the only ones that complete their life cycle. The larva wraps itself around the muscle fibers and grows until it reaches 1 millimeter. The larval form are encapsulated as a small cystic structure within a muscle cell of the infected host, as in the figure 5. The larval invasion of the muscles begins on the 8th day of the cycle. The larval growth is completed in about a month. The larvae live within the capsule for 10 to 30 years in the muscles, especially in the diaphragm muscles and the muscles between the ribs, tongue, and trunk. As you see in the figure 4, the life cycle of Trichinella spiralis. Here, when the man eats the meat of the pigs or pork undercooked, so the larvae release in the intestine and transform into adult. Then the adult female deposit larvae in the mucosa, then encysted in the muscles. So the encysted larvae is infective stage and at the same time diagnostic stage. As you see here, encystment or encysted larvae of Trichinella spiralis in muscles. Symptoms: trichinosis is usually characterized by 2 phases. The initial phase, intestinal, abdominal discomfort, diarrhea, nausea that begins 1 to 2 days after ingestion of the infected meat. And the second phase, or the muscle phase, muscle aches, itching, fever, chills, and joint pains that begins about 2 to 8 weeks after ingestion. In addition, there can be hemorrhages under fingernails and eye inflammation, conjunctivitis. Treatment in those with more intense symptoms, mintazole, can be used to eliminate the adult worms in gastrointestinal tract. Albendazole is another drug that use or may be used in some cases. The invasive and encysted larvae or larval forms of Trichinella species are treated with mebendazole. Diagnosis: examine the stool for the presence of adult worms or embryos in the first week of infection. Examine the blood during the second week of infection to see the larvae. Muscle biopsy may be used for trichinosis detection. The third example of intestinal nematode, Enclystoma duodenale. It belongs to the order Strongylida. The worms of this order have a copulatory piercer at the posterior end. The mouth does not have lips but have teeth, so they are called hooked worms. And the esophagus is club-shaped. Enclystoma duodenale and Nectar americanus are the two human hook worms. Morphology: small white worms that turn red as a result of a blood absorption and are characterized by extensive oral cavity. The front or abdominal edge of the mouth is equipped with a pair of sharp teeth in the form of hooks, and the inner pair slightly smaller than the outer pair, as shown in Figure 6. Males are 8 mm to 11 mm small with copulatory piercer at the posterior end. Females are 10 mm to 13 mm long with the vulva located at the posterior end, as shown in Figure 7. Females can lay 10,000 to 30,000 eggs per day. The average lifespan of Enclystoma duodenale is 1 year. As you see in the Figure 6, the teeth in the mouth is equipped with a pair of sharp teeth in the form of hooks. The Figure 7, as you see, the copulatory piercer of the male. Life cycle: adult worms live in the small intestine. The female lays eggs at an early stage of the cleavage with 2 cells or 4 cells. The egg is rectangular and translucent. Its edges are round. It has space between the cells and the egg wall. The egg is passed in the stool. And under favorable conditions, moisture, warmth, shade, larvae hatch in 1 to 2 days. The released rhabditiform larvae grow in feces and in the soil, and after 5 to 10 days, and after 2 molts, they become falciform third stage larvae that are infective stage. So the infective stage of Enclystoma duodenale is falciform larva. This infective larvae can survive 3 to 4 weeks in favorable environmental conditions. On contact with the human host, the larvae penetrate the skin and are carried through the blood vessels to the heart and to the lungs to the pharynx and are swallowed. The larvae reach the small intestine where they reside and mature into adults. As you see in the life cycle of Enclystoma duodenale, as you see this, the egg in the feces, you see here 8 cells in the cleavage form, then rapidity-to-form larvae hatches, then the rapidity-to-form change or transform into filariform larvae, which is an infective stage that penetrates the skin of the man. As you see, this male, because this is called copulatory parasite, just special to the males. Here, diagnostic stage is the egg with the special cleavage inside, but filariform is infective stage. Symptoms and pathology. Symptoms include general weakness, tiredness, and rapid fatigue after any effort, loss of appetite, gastrointestinal disorders, and diarrhea, dullness in the face, and sometimes swollen face and feet. In some cases of infection on children, physical and mental retardation in growth occurred. Damages include when the larvae enter the human skin, cause inflammation of the skin resulting in itching. During larvae in alveoli, rise in temperature and cough is often accompanied by blood. Worms feed on the mucosal membrane of the small intestine, and by their teeth absorb blood from the small blood vessels in the wall of the intestine and secrete substance that helps to prevent the blood clotting and moving from place to place in the intestine, leaving wounds in the small wall, and this leads to the inflammation in the intestine and anemia due to the blood absorption. In severe cases and due to the poverty of the environment, the person suffers from a lack of protein in the body and complications in the liver and heart. Diagnosis by detection of the eggs in the stool. As you see, the egg is rectangular, translucent, and there is space between the cells and the egg wall. Prevention: treat patients, avoid defecation outdoors, spread health awareness among citizens, and advise them not to walk barefoot. Treatment by mebendazole or Vermax.